Hey there, AbbeyWithNursing.com here. In this lesson, we're going to discuss a lab value called alpha fetoprotein. It's abbreviated as AFP. We'll talk about the normal value and also some clinical presentations or indications for why it might be drawn and increased or decreased. Let's get started.
Alpha fetoprotein is a lab that measures the level of AFP in the blood. AFP is produced in the yolk sac and the fetal liver, so during gestation. This lab is used to monitor fetal development and typically drawn during the second trimester of pregnancy. Some clinical indications or some presentations of what we might see for this lab value to be drawn is it has to be, or recommended to be, in the second trimester of pregnancy. It's recommended if someone that is pregnant has a family history of birth defects, if they're 35 years or older, which is considered a high-risk pregnancy, or someone that has diabetes. Normal therapeutic values, particularly during pregnancy, the levels rise between week 14 and 32, and then it's tested between 15 and 20 weeks gestation. That's the recommendation. So between 10 and 150 nanograms per milliliter is the normal value. Men and non-pregnant women, the normal value is 0 to 40 nanograms per milliliter. This lab is collected in a plain red tube, or it can also be in a serum separator. An increased lab value indicates a neural tube defect. Now, remember, this lab is being drawn in the second trimester of pregnancy. So this could be a very sensitive topic, right? So if it indicates a neural tube defect, that could mean spina bifida, anencephaly. This is a picture of what spina bifida looks like. What happens is the bones don't actually form around the spinal cord and contain it. Therefore, it's a defect in development. And then anencephaly is a condition that leads to improper brain development. So pretty serious side effects. A decreased lab value can lead to potential genetic disorders like Down syndrome or trisomy 21, like this little cutie right here. Our linchpins for this lesson are that alpha fetoprotein monitors fetal development. It's drawn during the second trimester between 15 and 20 weeks. A normal value for a pregnant woman is between 10 and 150 nanograms per milliliter. In reference to this lab, that's most often when you'll see it, is in reference to pregnancy. An increase in the lab value detects neural tube defects, and a decreased lab value detects genetic disorders or the possibility therein. Now, you've all done great in this lesson. And this wraps it up. Remember, we love you guys. We know you can do this. So go out, be your best self today, and as always, happy nursing.